I'm Alissa Murphy, and I was diagnosed with colorectal cancer when I was 36. I was shocked. I couldn't believe I had cancer. I felt fine. I didn't feel sick, and I thought, surely I can't have cancer. I'm an optimistic person, so initially my fear wasn't death. My fear was my quality of life. What is my life going to be like? Is it going to interrupt my daily routine? What are treatments going to be like? Will I be able to continue to work? Will I be able to have children? I knew that one of the side effects from, colorectal cancer was infertility. So fortunately at the time I had contacts in the reproductive world and was able to get some surgeries, had my ovary removed, that type of thing, to be able to hopefully be able to have children in the future. Once I accepted the fact that I did have cancer, I needed to get the best team together to be able to fight this cancer, and that's essentially what I did. I'm currently in pharmaceutical sales, so I have a lot of access to local physicians, and I did get a couple different opinions, and as I was asking physicians and coworkers in the area, there was one name that kept on coming up, and that was Dr. Fleshman's name. And when I made the appointment and met with Dr. Fleshman, he was excellent explaining the procedure and also gave the option to do this procedure laparoscopically. It was also my understanding that that Dr. Fleshman and Siteman was the only hospital in the area that did offer this procedure. So I was thrilled to be able to have the opportunity to have Dr. Fleshman perform this procedure laparoscopically. The recovery time was going to be shorter time in the hospital, and overall just a quicker recovery time for the patients. It was a less invasive procedure, and the scar would be minimal compared to a scar from the breastbone down to the pelvic region, something I think they refer to as a zipper. So for me it was just kind of a no-brainer, not only from a cosmetic standpoint but also just overall a less invasive procedure. I started initially with a chemo radiation for 30 days, followed by surgery. Within a week or so I was feeling better. And then a month later, I did start pretty invasive chemotherapy. And that was for 6 months. But yes, definitely I think the benefits of laparoscopic procedure is just that it's a less invasive procedure, less hospital time, and a quicker recovery time for the patient. So that certainly was my experience with having the procedure done laparoscopically. Basically, I am back to living a normal life, which is fantastic. I work out. I'm back to working full time. Pretty much am doing everything that I did prior to surgery, or prior to my treatment. So 3 years later, I feel like I have my life back. I've been wonderfully surprised and just very happy with how my surgery went, and really have been able to resume life back to normal. I in fact just came back from a dive trip to Cozumel. And that was the first time that I had been diving since my surgery, so that was fantastic. And my life is back to normal again, and I'm just very, very grateful for Dr. Fleshman, certainly the Siteman Cancer Center, that I have been able to have a normal life again.